afternoon, David. Thank you so much for joining me for a conversation about how COVID is impacting the world of drugs. Can I start by asking you to introduce yourself, tell us where you are in the world and what you do for a job?
Sure. I'm a professor in the School of Public Health at the University of Waterloo. That's just outside of Toronto in Canada. And I do work primarily in cannabis use, but I also do a lot of work in tobacco, e-cigarettes, and vaping and food. And we try and look at sort of big policy changes and how that filters down to what consumers do, what they think, what products they use, and how they source them. So now with COVID-19, it's obviously an interesting time to be following sort of consumer patterns and behaviors.
And that kind of leads me into my question, saying it's now May the 1st, 2020. Most people have been on lockdown for at least 4 to 6 weeks. From the work you're doing, what's been the impact of COVID on people who use cannabis products?
Well, I think like a lot of other countries out there, we've got lots of data on tobacco use, and things like cigarettes are fairly resilient to recessions and to other sort of economic shocks. And it looks like that's the case for cannabis in North America and certainly Canada, which is to say, we've never had a shock like this. And so what we saw was a lot of stockpiling behavior. So most of your listeners will know that recreational non-medical cannabis was legalized in Canada in October 2019. But we're still at a fairly early stage in terms of the legal retail shops. Some provinces have a lot more than others. So we have a mix of the legal and illegal markets still. But what we saw was a lot of stockpiling behavior. Some of the legal stores, which are actually run by governments in this country, reported record sales for the first couple of weeks. And then typically what you see is a bit of a tailing off in terms of sales. And it's sometimes hard to know. Part of that is because people have stockpiled. So people have more options for purchasing their cannabis in Canada than a lot of other places. And one of the things that happened is they essentially deemed cannabis stores as an essential service. So like alcohol stores, provincial stores remained open, and even the private stores allowed for curbside pickup. So we had one province that flirted with closing the alcohol and cannabis stores and then kind of reversed out of that because they realized that for various reasons, these are products that people use, probably more so in times of stress like we're seeing with COVID-19.
And particularly in Canada, where you have this coexisting illegal and legal market, and one of the challenges has been to move people away from the illicit market. I guess if you'd shut those legal shops, you would have almost undone all the good work you've done over the last year or so.
Well, it's really interesting. I mean, that's one of the big questions is we have an idea that I would expect cannabis use to remain stable and maybe to have increased a little bit, all said and done. One of the questions is how does it change where people are sourcing their products? Now, in Canada, it's a bit different than some people are aware of in, for example, with US legal states, and that is that we have online purchase and delivery. And so where I live in Ontario, our largest province in Canada, the government runs the store and they ship the cannabis products. And so they'll ship it right to your door. And that's meaningful. If you have a legal supply that you don't have to leave the house, lots of people would prefer, as we know for groceries, a lot of people are preferring to have things delivered and shop online. So it could actually create a bit more of a shift to legal sources, and we'll find out after the fact, but that is an important component of the cannabis retail market in Canada. And literally they will drop it off at your door. In Ontario, they've waived the delivery fee, which is usually $5 or $10. So, I think the wait time was 2 or 3 days. So you can stockpile legally and have it right to your doorstep if you choose. And we might see more consumers transitioning across. It's been happening gradually. Maybe we'll see an acceleration of that shift due to COVID-19. We'll have to see.
And what's so nice about Canada is you do have different states that have regulated in different ways. So you have a beautiful naturalistic experiment to see how those different models function at a time of crisis.
You're exactly right. And this is of interest beyond the pandemic. It's legalized federally in Canada at the national level, but we have 10 provinces, 3 territories, and they've gone about it slightly different ways. So common ground rules, but in some provinces, the retail is private, and some it's government, and some it's a mix. We have different prices. So we have a very interesting natural experiment, and we've seen some provinces come out of the gate very quickly where they've achieved a reasonable retail sort of saturation Other provinces have been very slow. And as a lot of your listeners will know, we know from legal US states that people love to sort of judge legalization at month 1, 6, or 12. It actually takes several years to establish the retail market. And we've seen a continual shift. Some would say more gradual than we'd hoped, but it is shifting from legal to illegal. And we have some really interesting regulations in Canada around edibles. We have some provinces that have capped THC limits at 30%. We have some that have said no candy, no chocolate edibles. That's about 95, 97% of the edible market. So what does that mean for legal, illegal? What does it mean for, we have a 10 milligram limit on THC in an edible through the legal market. So lots of interesting things, a slightly different approach than the US, and figuring out how those things interact with something like a pandemic is quite interesting.
And there's got to be few people who are better set, given the fact you have this longitudinal cohort study already in place, that, you know, this thing drops in and you're just going to be able to spot in a way that few other groups are going to be able to go, that was as a result of COVID, nothing else, because you have that data.
Well, that's the idea. You know, and one of the challenges with the cannabis markets is that it moves, there's this huge secular, whatever you want to call it, market transition on its own. So, you know, the proliferation of different products, you know, the biggest change we've seen in the last 12 months is the increase in vaping THC oils. So obviously with the nicotine sort of e-cigarette market, that has taken off. Well, so has the cannabis THC oil vaping market. So, you know, there's these big changes that are happening irrespective of whether jurisdictions legalize or not. And as you said, the purpose of what we're doing is looking in Canada before and after. We follow people in US legal states as well as US states that have not yet legalized. And it helps us to pick apart what's the general effect of legalization. And then what are the differences, like I said, in Canada, where we have very strict rules on advertising and marketing. Where we don't just put a stamp on each 10 milligrams of THC on an edible. You literally, if you buy a package, it can have no more than 10 milligrams. You know, and edibles have gotten associated with sort of adverse events and overconsumption and things like that. You know, I would not be surprised if what Canada has done for those that are buying legal products, I'm not going to say it'll solve the problem, but I suspect it will see far fewer cases of people having trouble dosing. So, as you say, very interesting differences, and also just trying to track what's happening in the market in general, because maybe with the exception of the nicotine vaping market, I've never tracked something that has been moving as quickly as this.
Given the fact that you have, you know, you mandated health warnings, you had federal oversight, was there a decision to alter the public health advice about how people consume cannabis in light of COVID?
So that's an interesting question. You know, I often have discussions about when you read sort of the lower risk use guidelines, what do we tell people? We tell people don't smoke it. We tell people don't use high THC products. We sometimes tell people to avoid edibles. What products are we advising people to use?
Suppositories.
Yeah. So, you know, I think there's a class of vaping cannabis. I think if you regulate edibles in certain concentrates reasonably so people can dose effectively, whether you want a very high dose or you want a modest dose, I think that'll certainly help. But in terms of COVID-19, there has been discussion about just general smoking and vaping, that if done frequently enough, it can contribute to underlying conditions. And, you know, maybe if people are really worried or susceptible, to think about different modes of administration. I've seen really interesting things from the cannabis companies themselves. So, you know, in their marketing emails and things like that, they talk about not sharing. You know, when 420 rolled around, which is a big deal in North America, it was, you know, don't share your vape device, you know, don't share joints, you know, maintain social distancing. So, you know, I think it does fit with the general recommendations people are getting, and it does make sense. I mean, geez, if we're worried about transmitting saliva or air droplets, you know, passing a joint around to your family members, maybe even or your buddies if you're seeing them, is probably not the best idea.
I love the idea how the cannabis companies proactively got involved with that. You know, it's smart. I mean, smart. It's the right thing to do, and it's the smart thing to do.
It does, and you know, who knows? Maybe there'll be some follow-on in terms of people have more choices than ever in terms of how to consume their cannabis, and we still really, most of our communications in most places before you legalize are just generic to cannabis. You know, one of the themes that I bang on about is that cannabis isn't one product. There are distinct categories, very different potencies, different modes of administration. You know, we don't talk about smoking cigarettes the same way as we talk about using a nicotine patch or smokeless tobacco or vaping. And so that education needs to become a bit more specific. And some of the discussion around COVID-19, you know, gets people talking about those options and pros and cons that each consumer will need to weigh when they think about how to consume their cannabis.
Yeah, no, it makes complete sense. So I guess the final thing is thinking more broadly around the responses. So shops were deemed open. You obviously got a very good public health and, you know, clinical medical service delivery system in Canada. What else has the Canadian government done to help other people who are using drugs and alcohol to keep them safe?
Well, that's a good question. And I think it's sort of like a triage situation where in the first, whatever, month or however many weeks of the pandemic, everything was just literally focused on shutting down and testing for the coronavirus. And I think now we're starting to see, for example, our government has announced some research funding specific to mental health and substance use as it relates to COVID-19. And, you know, it's not just the direct impacts on substance use, of course, or cannabis use. It's, you know, social isolation and loneliness, it's stress. You know, in our own survey, for example, we have just about half of consumers that tell us that they use cannabis to manage some mental health. Now, it could be low level anxiety or depression or just positive mood, but, you know, that's a big reason why people use substances, including cannabis. And at this time, you know, there's a lot of fear and loneliness and social isolation. So the government has announced some measures to look into that. And really, you know, I think the biggest sign was that they've kept the cannabis stores open. You think about all the different businesses that have had to shut. And living in Canada, it's been a bit of a wild journey in the last, whatever it is, 18 months since Canada legalized, because we went from it being obviously a prohibited criminal activity to something the government says this is essential for Canadians to be able to access. And, you know, morals aside, there's probably practical reasons for that, and it's a recognition that that a lot of Canadians are using this, and a lot of Canadians are probably using it in a fairly responsible way. So just the fact that the stores have stayed open, both government stores and private stores, I think that's an indication of certainly acceptance, much more acceptance of cannabis use, you know, alongside of alcohol use and things like that. So, I think Canada's done a reasonable job in terms of thinking about the implications for things like cannabis and substance use, but Lord knows, you know, how long this lasts for, and, you know, the true impacts we'll have to figure out over the longer term.
At least you're not south of the border.
Well, that's right. And you know, the concerns about small companies, private industry, are some of the cannabis companies going to survive? You know, it's not just about the consumer, it's about the market and supply end as well. You know, let's just hope everybody stays healthy and happy, and most people come out of this with reasonable employment.
Absolutely, and as much health and well-being as they can. David, thank you. That was the most fascinating oversight, and so different to so many of the other conversations we've had, because you're in this unique position of a federal response, and you're able to build on that. And, you know, for me, the takeaway message is you go away from prohibition to essential substance in the space of 18 months.
Yeah, and it's no news to anyone who's lived through this, but even those that work, I remember talking to the task force, which is the federal task force, which ended up recommending legalization. And even in those meetings, just the mind shift that's required, and you know, you talk about social norms as an abstract psychological concept, but boy, when you see it, it becomes a very tangible thing. And that psychological shift is very interesting. And I wouldn't say that we're at the end of it in Canada, but as I said, when you start to see, you know, cannabis access being considered something that's essential, you realize that we're fairly along that path. And the question starts to become not should people do these things, but what's the right environment to provide people with these products, and what's the right information to provide consumers to minimize risk and support their decision making. I think that's maybe where we're at in Canada today.
And you can only have that conversation because of the decision to make it legal.
Well, that's right. And, I mean, I said this all along, which is, opinion was favorable for legalization, public opinion, but a lot of reluctance, and it was by no means unanimous. But what I say, even if for those that weren't in favor of legalization, it's created a conversation. We've never talked more about cannabis, about health effects. We don't do very well at all in subtleties. We like to think about good drugs, bad drugs. Opioids are a perfect example of that. It's good if a doctor gives it to you. It's the worst if you buy it off the street. So it sounds a bit, like a cheesy saying, but it truly has created a national dialogue. And I think that does spill over to other substances. People start to say, well, we're regulating cannabis this way. What about alcohol, or what about these other things? And so, yeah, it brings into the open all of the things that are occurring anyway, sort of behind the shadows. And I think that's been productive.
Absolutely. And the rest of the world looks at Canada and goes, Canada didn't fall apart. They all seem quite happy. Shit, we could do that.
Well, and I always say, like for the industry, for example, there's a lot riding on this, national legalization in Canada. And in terms of the industry's responsibilities, if they can demonstrate that they can operate in a responsible way, if they, we've had a couple of legal challenges saying they want to be able to market more. If they can demonstrate, as you said, the sky doesn't fall, you can have a well-regulated market, and it actually improves some of the things that people are concerned about with cannabis. I mean, that's in the industry's interest, because this is a very large natural experiment in Canada. It is different than the US states. Mm-hmm. As you said, I think there's a lot of other countries watching to see whether this can be done in a effective, responsible way.
Well, thank you for experimenting on behalf of the world, David. It's really appreciated. And thank you so much for taking the time to share what's a really unique perspective on things. Stay safe, and I know maybe we'll catch up in 2 or 3 months' time, and you can tell us how things turned out.
My pleasure. Nice to talk to you.
All right. Take care.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for a fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine. Yeah. No longer focused on yesterday, and I don't care, the rest will say whatever they want. What's left to say? What's left to say?